Hello everyone, this is Dr. Shishma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are discussing about PCOS and obesity. In this topic, we will be deciding if all obese patients are prone to PCOS or all PCOS patients are prone to be obese. So let's dive into the topic to know more about it. And also we will be discussing why is it hard for a PCOS patient who is also obese to lose weight. So first and foremost, what we have to discuss is that we will be discussing about a section of people, that is PCOS plus obesity. If a person is PCOS, and that is if she is suffering from Polycystic Ovarian Syndrome, and also if the person is obese, why is it hard for them to lose weight? You have to remember that people who are suffering from PCOD will lose weight very easily. But PCOS, that is not the case. It is very hard to lose weight. So why is it hard to lose weight, and how to lose weight, and why do people who have PCOS suffer from obesity, and are they people who have PCOS and are lean? We will be answering all of these questions step by step. So first we will know what is obesity. Obesity has different definitions, but today we are discussing on the point of BMI. If you check your BMI, which is body mass index, and your BMI is accounting to be 25 or more than 25, that means you are overweight. And if your BMI is 30 or more than 30, you come under the obese category. So if your BMI is more than 30, that means you have already become obese. So your chances of getting other lifestyle disorders, like it can be hyperinsulinemia, or it can be type 2 diabetes, it can be cardiac diseases, it can be hyperlipidemia, it can be hypothyroid, or it can be PCOS, or it can be PCOD, are more. So here we are answering the first question. What is it? Do people who are obese, or people who are obese, will they be getting this PCOS? Yes, they have a increased risk or higher chance of getting not only PCOS but other lifestyle disorders, like which I've already mentioned, type 2 diabetes, cardiac diseases, hyperlipidemias, and even bone disorders also, and even thyroid disorders also. So if you take 10% of people who are obese and 10% of people who are lean and are working out, and you take another section of people who are 10 but they are lean but not working out, who will have higher chance of getting PCOS? People who are obese will have a higher chance of getting PCOS. The second group who will have a higher chance of getting PCOS will be people who are lean but who are not working out. And the least chances will go to people who are lean and are working out. So you understand that obesity can be a triggering factor or a step towards PCOS, but not all people who are obese will be getting PCOS. And here we have to talk about obesity and thick people. Many people confuse that I am thick, so I am obese. No, if you're not having any sort of extra fat near your belly or on your thighs or on your back, and you do not have any loose fat in your arms, that means you might be a thick girl. That is, your body shape might be different, but you do not come under obese. If your BMI is more than 35, or if your BMI is more than 30 and your muscle quantity is less and your fat quantity is more, they will come under obesity patients, or they will come under obese patients. People who are thick, who do not have any sort of belly fat, or whose BMI is normal, or whose muscle power is more, although the weight is a little bit too much, but the muscle quantity is good and the fat quantity is low, then they do not come under obese patients. Next, we will be answering the second question, that is, do patients who are suffering from PCOS are always obese? See, PCOS patients can be of two categories. Type 1 category, where they are suffering from PCOS and also they are obese. Type 2 category, where they are suffering from PCOS and they are lean. So they can be patients who are suffering from PCOS, but they can also be lean. It is not that if there are 100 people who are suffering from PCOS, 60 people who are suffering from PCOS can be obese and 40 people who are suffering from PCOS can be lean. It is not negligible or zero. Okay, so they can be 40% of people who are suffering from PCOS currently who are lean. Okay, that is important. Not all patients who are suffering from PCOS have to be obese. That is, the second question is being answered. Now, what is the connection between the PCOS and obesity? We are answering the third question, which is, why is it difficult, or how does the PCOS person prone to become obese. Here we will be understanding the pathological link. In this chart, while I'm going to explain, you will be able to understand how PCOS can trigger obesity and how PCOS can maintain the obesity and why is it hard to lose weight if you are suffering from PCOS. Remember that PCOS is a endocrinal disorder, so it plays on your brain and there is irregular pulsations of GnRH hormone, that is increased pulsations of GnRH hormone. Whenever there are increased pulsations of GnRH hormone, you will be having increased luteinizing hormone and decreased follicular stimulating hormone. So because of decrease of follicular stimulating hormone, you can have an ovulatory cycles, but increase in luteinizing hormone will trigger or can play a role where it will help in proliferation of the thecal cells which will produce androgens. See, in the female body, we do have very slight amount of androgen, but it should not exceed the amount. Whenever there is increase in luteinizing hormone, there is hyperandrogenism or excess androgen in the bloodstream. Whenever there is excess androgen in the bloodstream in the female body, you will be experiencing male type of obesity. So what is male type of obesity? See, for example, we take two women who are getting obese. The one person or the one woman who is not having this excess androgens will have her fat deposited in the lower part of the pelvis and also the buttock region and also the thigh region. And after that, she can start developing fat in the arms region. But people who are, or the women who are suffering from hyperandrogenism can accumulate the fat not in the pelvis region but in the abdominal region, which is a common way or common representation when we talk about male pattern obesity. So people or males usually store their fat in the belly, but women store their fat in the pelvis region. But whenever you're experiencing this hyperandrogenism, you will, though you're a female, you will be experiencing fat deposition in the abdomen area. So whenever there is increase in your belly fat, that means that if you're suffering from PCOS and you're having increased belly fat, that belly fat is very hard to get rid of. That is why they will be telling you, people who are suffering with belly fat, it is really hard to get rid of the belly fat, because there is a hormone working on keeping that belly fat. So that is why PCOS patients develop obesity, and that is why PCOS patients maintain obesity, and that is how PCOS patients find it hard to lose the belly fat. Belly fat is the last organ or the last part of fat that is left in your body to be reduced. First, your arms will reduce, your face will reduce, your legs, your thighs, your buttocks, everything will reduce, and then your belly fat will reduce. That is the last thing your body will want to reduce. So you understand how it is keeping. So you need a medication which will balance out that hormone so as to make you lose fat easy in a much easier manner. Okay, and you have to remember that while you're storing your belly fat, usually females come in different body shapes, right? We can come as inverted triangle, we can come in the form of pear, we can come in the form of hourglass. Every body shape is beautiful in its own manner, but apple shape especially, if they are depositing, if a person is hourglass shape or pear shape and they've suddenly changed their body to apple, that is sudden change in body shape from any form of shape to apple shape can make you feel like or can be a depiction of hyperandrogenism. That is why people who are in apple body shape find it very hard to lose weight. That is the connection between obesity and apple shape, because apple shape people have fat in their belly region. We have discussed if all PCOS patients are obese or not. We have discussed about obesity or how is it defined in a very simpler manner, and also we have discussed how pathologically PCOS is related to obesity, and also we have discussed why is it hard for a PCOS patient to lose weight. Now we will be discussing why to lose weight. This is a very important question. These days we are getting notions or quotations like love your body however it is. remember that body will show you certain symptoms, and if you're ignoring the symptoms and making it your love language, it will be hard for your body to repair itself, because obesity comes with inflammation. So what I'm trying to tell you is, every body shape is important and every body shape is lovable. But if you're someone who is having belly fat, or if you're someone who is developing a lot of fat and decrease in your muscle count or in your muscle power, then you have to understand these are symptoms of your body and you have to work on them. So by losing weight, what will happen? What are the benefits of losing weight? Remember, your height and your weight should be normal or within limits. If your weight is exceeding, many people, if their weight exceeds by 1 or 2 kgs also, they just feel like we are obese. They just feel that they are obese, although they are not. So how to understand if you're obese or not? If you're someone who is 5'4" and your weight is, in 60s, that means you're proper in height and you're in your weight. But if you're someone who is 5'4" and your weight is 65, then do you come under obese category? You have to check if that 65 kgs of weight has more of fat or more of muscle or more of bone. If it is more of bone and if it is more of muscle, you need not worry and you do not come under obese personalities. But if you're 65, although 65 is not a big count for 5'4" people, but even in that 65 kgs count, if there is decrease in your muscle and if there is decrease in your bone density count and increase in your fat count, you can go to a stage of obesity, or you can progress to a stage of obesity. So why should you lose weight? You should lose weight to decrease your insulin resistance. You should lose weight to regularize your periods, because losing weight will balance out your hormones, and balancing hormones can create a proper weight loss mechanism in your body, and it can trigger happy hormones, whereby your emotional state is good as well as your physical state is good. So hyperinsulinemia is decreased, your PCOS regularized menses can appear, and also your diabetes can come under control, and in some cases can be reversible, and also your thyroid can come under control, and your inflammation will go down, your hair fall will go down, you will be able to move better, you will be able to feel better. All of this will come under reasons why you should be losing weight. Then how to lose weight? If you are someone who is suffering from obesity, you have to understand that as soon as you start diet, if you are not going to a proper nutritionist or a doctor, if you are doing diets on your own, following some crappy content, they will tell you to cut down all your carbs. If you cut down all your carbs, there will be a mechanism in the body which will cause ketoacidosis. Many people do not know this, and it can go to kidney failure. If you are only taking protein or if you're only taking fat, there is higher heat produced when to break your protein and to break your fat to convert it into energy. You need energy to move here and there, right? So what form of energy should you be taking? You should be taking not simple carbohydrates but complex carbohydrates. First thing, do not skip your carbohydrates and replace simple carbohydrates with complex carbohydrates. First thing. Second thing, if you are eating 3 times a day, make it 6 meals a day. Divide your portions and eat smaller quantities at frequent intervals to decrease the glucose spike, and also it will decrease the hyperinsulinemia or this insulin resistance symptoms. And then include a lot of fiber in your food. People who want to lose weight and when they start hitting gym, they concentrate a lot on protein content and neglect the fiber content. Fiber is very important, otherwise you will be having gut microbial issues. So consume carbohydrates but smaller quantity, and consume carbohydrates which are complex. Make your 3-day meal into 6-day meal. Include fiber in your meal. Concentrate a lot on protein, that to good forms of protein. Decrease red meat and also decrease prawn and crab consumption or lobster consumption as such. Include eating fish, which is good source of omega-3 fatty acids, and include eating fruits but not too much of fruits. You can consume 150 grams, 200 grams of fruits per day. Try to eat mono fruits, that is fruit that if you are eating a papaya, eat simple papaya only. Do not mix papaya with watermelon. If you are eating watermelon, eat watermelon only. You can eat monogamous foods, which is foods which are simple and also have single substance. If you are eating a single form of fruit, that is, you can eat guava, do not mix it with orange. Like, do not eat complex or mixed fruit bowls. Try to concentrate on eating a fruit bowl which is 150 to 200 grams and it has one single fruit. And then try concentrating on eating smaller amounts of good fat. People feel that fat is bad. Wrong. Fat is good. Good fat is very good because your hormones are made up of proteins and fats. Your brain is made up of fat. If you do not consume fat, you will experience on a longer run, you will experience brain atrophy. So include good amount of palatable fats in your meal. All these changes can make you or can bring your weight under control. Apart from doing diets, you should also exercise so as to not decrease your muscle count and increase the muscle count, so that by increasing the muscle count, the glucose spikes can be decreased. Now coming to conventional form of treatment, or what would an allopathic doctor suggest to you if you are suffering from PCOS and obesity, and also if you are having lifestyle disorders. They will first suggest to you for your type 2 diabetes, if you are suffering from type 2 diabetes along with PCOS, metformin, but the side effect of metformin is muscle depletion. And then they can suggest you anti-obesity drugs, or they can keep you under anti-obesity injections where you can lose up to 10 kgs in a month. But is it healthy? You have to remember that body takes time for everything. If you have gained weight in years and if you are decreasing weight in days, it can be very bad for your heart. Heart health can be depleted. Your muscle can start depleting. Your body will experience sudden loss or sudden weight loss. The body will trigger certain mechanisms of inflammation. They will release certain chemical mediators. So it is not advisable to go on an injection or an anti-obese drugs. Rather, lose it through proper diet, exercise and good amount of sleep. Next, other medications and bariatric surgery. If you're someone who is using medications, or if you're someone who is taking bariatric surgery, remember that after bariatric surgery, your hunger can decrease or your consumption of food rate can decrease. But it is usually advisable for people who are very, very, very obese, and also after bariatric surgery, although your hunger is decreased, your cravings for a certain food will not decrease. If you are doing proper diet, increasing your protein, the craving for sugar content will decrease. But if you are going through an anti-obese drug or a bariatric surgery, your hormone levels are not, decreasing or depleting. Your hormone imbalance is still there. So your craving for certain food is also still there. After bariatric surgery, you are continuously consuming carbohydrates, that is simple carbohydrates. You are consuming a lot of chocolate, even though chocolate accounts for 50-60 grams, it holds on a lot of calories also. So it depends upon how further you want to take that decision of maintaining a good lifestyle. Even though you are getting a bariatric surgery, if you are not maintaining a proper lifestyle, it can lead into again becoming obese. Now comes the form of treatment which has no side effects to it. It is effective in nature. It will balance out your hormones, thus by balancing your cravings and also making a way for you to lose weight, and also your abdominal weight can decrease through proper constitutional form of medicine. It is no homeopathic form of medicine offers you a wide range of safe forms of healing, wherein physical trauma of PCOS can be healed, your obesity will come under control, your hormones are controlled, your menses are regulated, your periods are regular, and also the bleeding has come under control, or your clots have come to decrease. All of this can happen through homeopathic form of treatment, which is utterly safe. And the recurrency form of obesity or PCOS or type 2 diabetes in homeopathy compared to allopathic form of treatment is low. And also, not only does it offer a better chance of living happily and healthily, it also offers a chance to give you safe, effective and also no side effect form of treatment. So if you are opting for PCOS, allopathy does not have a cure for PCOS, but homeopathy does. Allopathy will give you anti-obesity drugs where you are losing a lot of body weight suddenly, but that is not going to balance out your hormones. But in homeopathy, the constitutional medicine will work on you, where slowly you will start to lose weight, and also your PCOS symptoms will start to decline and you will experience health. See, I am telling this loss of body weight for people who are suffering from PCOS. We are not talking about people who are trying to eat much even though they do not have craving. They just eat and put on weight, then and their homeopathic medications might be different. But in people who are suffering from PCOS and obesity, homeopathic medicines will work wonderfully in maintaining that hormonal balance, and also your cravings for a certain sort of simple carbohydrate will also decrease in homeopathic constitutional medication. We have discussed how homeopathy offers or gives a better shot at PCOS and obesity and even type 2 diabetes, or to that matter any female reproductive organ diseases. Here we are talking about, in homeopathy, we are talking about Fidicus homeopathy, which will give you a better way to cure yourself. Here we have two types of consultation options. One is online consultation option, the second one is offline consultation option. If you are someone who is staying in the nearest branch of Fidicus, you can come and contact us in person. But if you are staying far away from us, you can contact us online through audio consultation option or through video consultation option. Once the consultation is done and once the case is taken and investigations are reviewed, especially to the online clients, our medicines will be delivered to you to your home. If you are staying in India, it can take 3 to 4 business days. If you are staying in USA, 3 to 5 business days. And across the globe, anywhere, our medicine can take time of 4 to 8 business days for our medicines to reach your doorstep. If you are someone who is suffering from PCOS and obesity, or if you are suffering from female reproductive organ diseases, you can contact us through this number which is displayed on the screen. You can call us, you can WhatsApp us, or you can message us through this number. And if you want to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. We have discussed how homeopathy offers a better shot at lifestyle disorders and also chronic disorders. Now we will be talking about why Fidicus Homeopathy should be opted. Fidicus Homeopathy stands for highest chance of health. Here we are following three principles. The first one is, we have already experienced higher success rate in people who are experiencing PCOS. We have brought down the symptoms of PCOS. We have brought down the symptoms of PCOD. They're having a better lifestyle. Their fertility rate is increased. People are conceiving. They're having good pregnancy. Outcomes of all of these diseases are really good. So high success rate. Second one is transparent treatment. Here we do not have any gray area between the patient and the doctor. We will be explaining the prognosis of your case in a very clear manner to you. And apart from that, when we come to the personal care here at Fidicus Homeopathy, it is top-notch personal care. Here we will be busting all of your myths. We will clear all of your doubts. If you want to opt for health, if you want to opt for cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.